And how important is parent-infant attachment in this intergenerational trauma? Like, how much of an impact does that have on things?
It's everything. The whole idea of being able to change their brain. So let's say hypothetically we've got an example of a woman who had experiences of multiple generations of trauma, and attachment was complicated, avoidant, anxious, doesn't matter what the language is. And then she has a child, and all that child needs is to be held and to be loved and to experience warmth. But we've got to remember that infants, when they're born, they have a nervous system, but they don't have an integrated nervous system. So every single response that they have is entirely influenced by what is met and mirrored back to them by their parents, particularly their primary carer. So if their mother doesn't attach to them really well, then we know that that creates a child that then perpetuates that attachment issue or perpetuates that traumatic response. But then we also know that their brain is developing to see the world through that trauma lens, to see the world through that deficit, that shortcoming, and then that fear pattern is set off, essentially. So everything comes back to the early years being the most important. But I think that, if we just assume that it's going to just be, the first 3 or 4 years of a child's life, that's probably a bit naive, because they're learning it at every stage. But the attachment that we get in those first few years is obviously the most profound, because their brain is growing at the rate that it's growing. And so you want their brain to grow to match the healthier version of yours.
I suppose one thing that the listeners might be thinking, hearing that, is like, well, how do you know you're doing enough? How do you, what's the right amount of attachment? And, how can you ensure that you're giving enough so that you can minimize the risk of any sort of feelings of insecurity or a lack of protection from your caregivers, when they need it the most, essentially?
It's that tricky pendulum or balancing act of not giving too much that your own self-care goes down, so then you can't take care of yourself, so then you're not going to be a good example to them, and then not over and not smothering them or not allowing them to be free to be able to expand themselves. But I think there's a piece that parents reach. Isn't it funny how we're focusing on the parenting thing? But I think there's a point that parents reach where they go, my child feels safe. And as soon as my child feels safe, it does matter, but it doesn't matter that much about the subtleties around it. If they have that sense of that they belong, that they're loved, that they're seen, then you're setting them up to be able to manage and navigate all of the experiences that come for them. But if they're not seen, if they're not heard, if they're not listened to, obviously all the big guns are out, no abuse, none of all that sort of stuff, then all the subtleties, you just don't beat yourself up over it. And then you are doing enough.